You're dealing with dizziness that maybe is unresolved from doing things like the Epley maneuver or vestibular therapy. Well, I may have a novel solution for you. I'm Dr. Norris and I'm the owner and clinical director here at Chiropractic in Louisville, Colorado. And I'm a NUCCA certified doctor who focuses on the upper neck and the upper cervical spine. Ultimately, I take care of the whole spine, but I find a lot of people's problems are up in the cranial cervical junction. And so that's really where your head meets your neck, right? CO, occiput, C1, atlas, and C2, axis. A lot of people have had a trauma in their lives, maybe a concussion, usually that includes a traumatic brain injury, a whiplash injury, or other significant trauma like falling off a mountain bike going full speed or falling backwards when you're ice skating, right? These injuries oftentimes result in symptoms years later, right? So sometimes people feel the concussion effects. Sometimes they do get, vertigo or dizziness right away. Other times, for example, Meniere's, what we find is that usually about 7 to 10 years after a pretty significant whiplash injury, the neck pain is long gone, but all of a sudden maybe there's some arthritic changes in the neck pain starts coming back, and then it's accompanied by, dizziness, fullness in the ears, ringing in the ears, and sometimes even really severe, what we call drop attacks. Now, sometimes it's an inner ear problem, and sometimes you need medicine to make those things better. But a lot of people who don't respond to that are wondering, what can I do next? And if that's you, I want to talk to you a little bit about the anatomy of the upper cervical spine and how the advancements in technology like cone beam CT, which is a 3D scan, or CBCT, is a 3D scan of the head and neck, similar to when you go to the dentist and you get that panoramic scan of your jaw. We have one in the office now. This is very cutting edge technology. There's a couple, dozen doctors really in the country who are using this. It's the same tech as the dentists use, but I can see the whole head and neck, and I can really analyze the entire anatomy, both in slices, like you would with a traditional CT scan, looking at very, small anatomy pieces down to under a millimeter. And I can also look at the overall structure and alignment and how the upper cervical subluxation complex, this twist and shift on top of the spine, is ultimately affecting your health, right? So one of the things I want to talk today a little bit about is the carotid sheath. So a lot of people maybe are unfamiliar with the carotid sheath. The carotid sheath is a bundle of blood vessels, specifically the jugular vein, right? So blood coming out of your head, and the carotid artery going into your head, as well as your vagus nerve. A lot of people know about the vagus nerve. It's the longest nerve in the body. You have two of them. They both come out of the base of your skull, go down through your neck, and essentially touch every organ in your body other than the lowest part of your digestive tract. This nerve is known as a sensory nerve, meaning about 80% of its function is sensing what's happening in the body. And then 20% is actually like doing things to those organs, right? So I think of it like a thermostat, right? It's measuring and then telling the brain what to do. And then the brain's can respond by either, spitting out some hormones through the pituitary gland into the bloodstream, or maybe having other neurological effects directly through the nervous system. Now, this carotid sheath, runs up through here. You can, when you feel your pulse on your neck, you're feeling your carotid artery, right? Now, the carotid sheath, this model here, I'll probably put a picture up here to show you, but there's a little hole here at the base of the skull that you can't quite see. You can see this pointy little bone. This is called the styloid process. This bigger lumpy bone right here is the mastoid. So the mastoid is that big lump kind of behind the ears. And then you have your transverse process, which is the side of your C1 or your atlas bone. You can usually feel that kind of like behind your jaw, under your earlobe. It's usually, for some people, very tender. And especially if you're dealing with a lot of this dizziness and you're like, yeah, I got this pain. Sometimes people categorize it and think they have TMJ. Other people think that they have ear pain, but it's really coming from the cranial cervical junction here, right? So if you have a twist at the top, one of the things that we're starting to see with the 3D scans, because what two-dimensional x-rays wouldn't show us was as much detail as that we can see with the CT scan. And now that I'm looking at the slices of how all of these bones line up, and we look at the atlas bone, what we can see is sometimes the bone will be twisted, right? So you have a misalignment, it'll be rotated anteriorly, for example, and it can go both anterior and posterior, of course. So it moves anterior, and then it moves closer or approximates to the styloid process. And normally we want a nice space in there for this carotid sheath to go up into the skull, where it goes both ways, but essentially allowing this bundle of very important structures to have a nice open space. And what we've seen many times before is on an MRI, because many of you have had MRIs of the head and neck, and it may go, quite honestly, misdiagnosed or underdiagnosed, that with the rotation of C1, as it comes closer to the styloid, it actually compresses the carotid sheath. So we'll see on one side, it's very open. On the other side, it's very compressed or closed. Ultimately, this is going to affect blood flow in and out of the head. It's also going to affect autonomic function because it's over stimulating and compressing the vagus nerve, okay? So essentially, simply put, when we get a good correction with a very gentle and specific adjustment on the top of the spine here, we can open up that space. And that's why we'll see a lot of people who will see sometimes even instantaneous results with their dizziness, even though they've tried, the Epley maneuver. Again, they've maybe done vision therapy and vestibular therapy, and nothing quite nails it on the head. And so if that's the problem that you've been dealing with, if you're looking for a solution and not just being thrown, a next medication because the last one didn't work, or trying a new therapy, I'd really encourage you to seek out a upper cervical specific chiropractor. Again, this is very different than traditional chiropractic care. You need to find someone who ideally specializes in NUCCA. There's also Atlas Orthogonal, Orthospynology, Blair, and knee chest. But ideally, if you're dealing with these issues, you find someone who has a cone beam CT or a CBCT, because they're going to be able to really appreciate your anatomy from the three-dimensional view and understand, especially when comparing to prior MRIs, or maybe they even order an MRI for you, to understand how the soft tissue structures, like the carotid sheath, are interacting with the osseous structures, your bones, right? And again, with a very gentle and specific adjustment, we can often realign the bones, creating the normal space that should be there if you were in alignment, right? This also gets great results with other issues, whether neurological or just chronic pain. So if you're struggling with these issues, if you're looking for a novel approach, I encourage you to look into NUCCA, check out Koru Chiropractic, and if you're in the area or you can travel here, we'd love to serve you. Have a great day.